Well, ladies and gentlemen, and everyone, it gives me enormous pleasure to welcome you to this very special webinar for National Advanced Care Plan Week, which is the 21st to the 27th of March. My name's Julie McCrossin, and it's my great pleasure to also welcome Dr. Merran Cooper, the CEO and founder of Touchstone Life Care, and we'll be hearing from Merran shortly. Ladies and gentlemen, our hosts today are indeed Touchstone Life Care, and our topic is the future of advanced care plans in a post-COVID world. And as I said, my name's Julie McCrossin, and I'm really thrilled to be here because I've had very direct experience of the value of advanced care planning. 9 years ago, I was treated for stage 4 throat cancer, and I learned just how important it was to talk to my family, my close friends, and of course the key medical and other health people in my life about what my preferences would be as my treatment continued. I was facing a life-threatening situation, so I did need to plan for all eventualities. And so how pleased am I to be part of a promotion, really, a discussion in this special week about why we all need to make an advanced care plan and have those important conversations. Before we begin, I would like to acknowledge that I'm broadcasting to you on the land of the Kaurna people. I'm in Adelaide, and I think, Merran, you would be with the Gadigal people?
I'm on the land of the Camaragal people of the Eora Nation.
Okay, thank you and welcome. And we both acknowledge elders past and present, and we urge you to reflect for a moment on the land where you are across Australia and indeed across the world. There may be other First Nations people represented. Our purpose today is to explain advanced care plans, encourage you to talk to key people and start making a plan. And we also want to tell you about the Touchstone Life Care special digital service. It's all about making a plan, storing a plan, having 24/7 access, and what I find very appealing, a reminder system for regular reviews. And our format is going to be an interview with regular opportunities for your questions and comments. So quick housekeeping. We can't see or hear you. The way we know what your questions are is to look in the Q&A. So please go to Q&A, put your questions in now, and we're going to answer as many as possible. We'll keep it anonymous, but we would ask you, if you can, to nominate the part of the world that you're in, the part of Australia that you're in, your region or your state, just because it's so interesting. And any questions that we don't get to will inform future webinars.
And that's actually in the chat box. So people ask their questions in the chat.
Oh, is that right? Okay, thank you very much. Okay.
It's the chat.
I think Q&A. I think that we might get clarification from our invisible friend Anna. And
you're all guessing it already. Hello, Leon.
Okay, thank you very much. So anyway, it's my great pleasure now to welcome Dr. Merran Cooper. As I said, the CEO and founder of Touchstone Life Care. Merran is a medical doctor. Early in her marriage, some years ago, she lost her beloved husband to leukemia. She subsequently trained as a medical doctor, and those experiences as a working doctor, combined with that earlier experience with her late husband, made her very committed to the importance of advanced conversations and advanced planning. And I've asked Merran to share a little bit about her personal experiences that have informed her commitment to advanced care planning. So look, just before we get into that deeper material, Merran, for the new people watching us today, what is an advanced care plan?
I like to think of an advanced care plan as a love letter to the people you care about, to anybody who is going to be making decisions, medical decisions about you in the future when you can't speak for yourself. And the reason I like to think of it as a love letter is because you're telling them, the most important people in your world, about the most important things in your life. And you're trusting them with that. And you are also saving them from some really horrible situations where they might be facing conflict and having to make decisions about you. It's called an advanced care plan, includes the directive, which is some legal requirements around CPR and end-of-life care, but a plan also includes the names of those people you want to be making decisions, your substitute decision makers, and also, most importantly, your values, your preferences. It's you on a page for other people to make choices about on your behalf.
In preparation for our discussion today, it's come to my attention that under 20% of Australians actually have an advanced care plan. So for people who are listening now, really turning their mind to it, maybe for the first time, one or two key reasons why you should begin, even if you're just a little bit anxious about the idea.
You should begin because it takes longer than you think, not only to have a conversation with yourself about what really matters, but to have lots of conversations with your trusted contacts about what matters, about what your plan means to you. And then you need to empower those people to speak on your behalf. That doesn't happen overnight, and it certainly doesn't happen in a hospital situation. And as I will show you it very shortly, it doesn't even happen in the couple of weeks before you go to hospital. It has to happen well in advance.
And in our title today, we've got in the post-COVID era. I thought that was rather optimistic, actually. I don't think we're in the after-COVID period yet. But obviously the point is, you think that advanced care planning and having conversations about care preferences is even more important because of COVID. Again, why?
Absolutely. Because, and can I share my photograph with you? Because it
Please do. Let's see the photo. Ladies and gentlemen, if you've just joined us, we're going to see some images from Merran's life to inform our discussion about advanced care planning, and welcome to those who've joined us from New Zealand. Very excited to see you have joined us as well. So let's see that image of your daughter.
We're moving on from an advanced care plan as a document to an advanced care plan that is digital, shared, and instantly available. So that's great. But this photograph is my daughter, Phoebe. She took it as a selfie, as kids do. And there are not very many children, 30-year-olds or 40-year-olds, who will remember to grab the right piece of paper as they're running out the door to help you in an emergency. Your plans have to be on a phone, in the cloud, available as a QR code. Pieces of paper don't work, but particularly in COVID, I have 3 children, but only one was allowed to visit me, Phoebe. So throughout the time where I was having some serious surgery with some possibly serious outcomes, she would have been the only person who would have been the conduit between the doctors and the rest of my contacts. Only one. And it's not fair to expect her to be in the position of having to make the call if I haven't had a conversation in advance with everybody else. She knows that her siblings have got my plan on their phones. Any of them can send it to the hospital by an email or by a QR code or through other means. They've all discussed it ahead of time. It's traumatic enough making end-of-life decisions on behalf of somebody else, let alone if it's only you talking to the doctors. So COVID, you have to have your preparations done well in advance. And the other thing I'd like to mention, Julie, is in a time of COVID, and I agree, it's not a post-COVID world yet, sometimes an opportunity comes up for surgery and you have to take it when it comes up because it might not come again. So this unpredictability is in our world more than ever, and we have to prepare for it.
Merran, thank you so much. And ladies and gentlemen and everyone, we're now going to go to a poll so we can just learn a little bit about you. So I'll read out your first poll question and then ask you to answer it. What do you think is the most important benefit of advanced care plans? And we want you to give a single answer. Increased person-centeredness of care, reduced over-medicalisation and unwanted treatments, reduced family conflict at end of life, increased peace of mind for patients. please choose the one that you think is the most important benefit of advanced care plans.
It's terrific to see people participating and really thinking about these questions.
It is, and we're going to hear in a moment about your guided questions to help us start, but let's see the answer to poll question 1, please. So what do you think is the most important benefit of advanced care plans? 31% are saying increased person-centeredness of care, reduced over-medicalisation and unwanted treatments, 16%, reduced family conflict at end of life, 31%, increased peace of mind for patients, 22%. Just reflecting on that as we go to question 2, poll question 2. Have you ever had a conversation with your family about your end of life plans? Yes or no? And we'll see the answers, please. 74% have said yes, and 26% have said no. And our third question, please, our third poll question. Have you completed your own advanced care plan, updated it in the last 12 months, and shared it with those who need to know? Yes or no, have you done all those 3 things? And the answer, please. 22% have said yes. Merran, I feel like giving them some sort of prize through cyberspace, but 78% have said no. Look, thank you so much. And I'll return to my conversation with the founder and CEO of Touchstone Life Care, Dr. Merran Cooper. Just before our next question, your response to what you've learned about your audience there, what strikes you?
People are not so concerned about over-medicalisation, but they want person-centred care, and they are quite rightly concerned about family conflict because there's so much triggering that goes on in these conversations. It's far better to bring the conflict forwards, deal with it now, than have it happen over an ICU bed. But what really is important to me was number 2 and number 3, and we asked those questions in that order for a reason. Most people assume that they have had a conversation with their family member, but they haven't turned it into an advanced care plan, and they are leaving themselves open for all sorts of misconstruing of what the person heard or thought they heard you say, as well as a doctor saying, where's the evidence? I know that you may have talked to your mum, but I need a verifiable document in front of me.
Let's turn now, Merran, then to the Touchstone Life Care support system for making an advanced care plan. Can you share with us some images from your website that really offers us a sort of guided process to beginning the planning process, and just describe some of the key features of the support that you give people to make this all-important plan and to have the conversations?
Sure. Well, Julie, I've actually put 3 images in one on this slide. And if we can all focus on the box on the left, you'll see that it is a fairly easy to complete questionnaire. So rather than downloading 26 pages from a website and not knowing where to start, going on to Touchstone Life Care is a no-threat situation. You can work through questions very slowly. You can see we've got questions 2 to 5. There are around 27 questions like that you slowly work through and write your own responses to. So we chunk it down into individual scenarios. In addition, there are other ways that you can document your values and preferences and write a lot about your own personal notes. So it's a lovely combination of clever technology, but also personalization. And it's zero risk, it's zero cost to do that self-exploring, that guided interview process. You can play around, have a go, leave, come back another time. And it's only when you are happy with most of your answers and say, I think I'm ready to share this now, that our system will generate an advanced care plan for you from your answers. And it's still not set in stone. You can still change your mind anytime, instantly. But what we do is encourage you, we help you, and we make it automated to share your plan. Every time you change your wishes, everybody is automatically notified. You can choose to share this with whoever you want, including your care provider, your GP, your solicitor, or your hospital. So there's lots of other features, but then when it has to be found instantly at 3 a.m. in the morning, when GPs and lawyers and care providers are not available, that's when you've got a QR code for your emergency and your ambulance to scan. And it's a live document. It's just like a Facebook page. It means if you make changes, that's what everybody sees. There's no outdated old versions lying around.
So key things I want to hear is it makes 24/7 access available. It has an automatic process of reminding you to review, and it also makes it very easy to share information. We've got a lot of questions coming in, but if I could just say one thing, because even though I already have an advanced care plan, I have actually been going through this process out of curiosity and as a means of updating the plan that I made 9 years ago when I had stage 4 cancer, and which I have to tell you, I haven't looked at again and haven't reviewed, which of course isn't a good idea. And I have found it immensely thought-provoking to both answer the questions that are offered by this, but also to fill in the notes. And I thought I do have a close relationship with my partner and my daughter, but we've been talking about this together, and it's definitely deepened our mutual understanding of what we each would like should we face serious medical interventions. But look, let's go to our first question, because we've got questions coming in. So let me just quickly get up our questions, if I may. And I'm just looking for our first question. Thank you. I'm just having a little bit of trouble identifying my question. If I could have help through cyberspace as to where the safest place for me to go is on the questions.
I've got the Q&A. Under the Q&A there are some questions.
Okay, so one question I have is, how do things change if I change state in Australia or move overseas?
Great question. So actually they don't have to change with this system. So it's what's called a common law advanced care directive. And if I can just share that slide again, you'll see that as a common law advanced care directive, it is legally valid in every state in Australia, most states, even in the US and UK, but you can hear other end-of-life documents. You can also upload other end-of-life documents like your power of attorney, etc. So we can, you can upload additional things that will help those doctors make decisions about you.
I've got another question here. During COVID, we're more aware that the pressures are on the health system, hospitals, ambulances, the need for ventilators has been in the media. How has this impacted the responses and decisions and the way people are completing their advanced care plans, this COVID pressure?
Yeah, there is COVID pressure, spot on. In the people in residential care who are using this tool have reported to us that they are asking that specific question. If you get COVID, do you want to go to hospital to have it treated? And let's talk about the impact of ventilation on lungs that might be 85 years old and already a little damaged. So there is space in the app to write your specific questions to those COVID questions, specific answers to those COVID questions.
I ask you, Merran, there's quite a bit of focus so far on the notion of end-of-life planning, and it's commonly associated with us getting older or possibly needing to go into aged care. But as someone who was given a sudden stage 4 cancer diagnosis in her late 50s, and with a partner who recently fell off a wall and had double very serious surgery, also in their mid-50s, and had spent a considerable time in ICU, isn't it important to have an advanced care plan and these conversations regularly at any age? Because one question that has come through from our audience is, at what age should I begin my advanced care plan? How would you answer that?
As early as you want to have important conversations about in what's most important to you with the people you hold most dear. And that often happens when you get married or when you have a child. So I was asked by a lady last week to help their 35-year-old son-in-law have this conversation. He was a tradie. He was an electrician. He'd fallen off a roof and been electrocuted and got resuscitated, but he had a big scare. And it made him start thinking about these sorts of questions. He actually asked his father-in-law for some help, not his wife, the next of kin, his father-in-law, to help formulate deep down his answers, and then generated a plan and then started the discussions with his wife.
We've got a couple of questions that go to the digital nature of the Touchstone Life Care system for having a 24/7 available care plan. And the first one is, what is if the ambulance doesn't have a QR reader?
Oh,
Perhaps explain quickly what a QR reader is for the uninitiated.
A QR reader is a phone, a mobile phone, just scans it with a mobile phone. And we developed this system with the input from the ambulance and from paramedics, not only with people and families and GPs and ED surgeons and care providers, but also with the paramedics. And the way in which the plan is viewed when you scan the QR code is exactly what the paramedics need. You answer the questions and you speak about values and preferences, but the plan that gets generated has the emergency answers up the top, right there where the ambulance needs them.
Thank you so much. Another question from our audience. With having, sorry, I've just had it move, but essentially with having the availability in the cloud, it does require a certain level of digital literacy. So what, I guess there's two parts to this question. What if the person themselves who wants to have a 24/7 available plan lacks digital literacy? And then I guess the concern that perhaps in the residential aged care or even in a hospital setting, there may be limited digital literacy in a critical person. What would you say to that?
Sure. Look, you can print your plan as well. So online, you can print it out and have it as a written document to hand to anybody. But also it has to be digital. That is how we communicate inside our hospitals. As doctors, pieces of paper get coffee spilled on them. So you cannot have just a piece of paper. But this is where a daughter, a granddaughter, a care provider can sit along somebody and just help them through it.
And as someone who spent a lot of time in acute admissions with my late mother, I suppose I also see all these conversations so that the key person in your life or people in your life who are likely to be at the hospital very, very fast or with the ambulance or at the aged care service, that if they are clear in their mind as to what your preferences are, they are important carriers of information as well, aren't they?
And not just carriers of information. They have to sometimes be your advocate and prove that this is what you want. And I noticed that we've just had a chat that says in the regional areas, there is no reliable internet, but that is why you can email this plan ahead of time. So it's on somebody else's phone ahead of time as a QR code that does not require internet, and you can print it and you can upload it to My Health Record didn't show that on the screen, but we show you how to click through to upload it to My Health Record. So there's print, QR codes, phones, emails, My Health Record. There aren't very many other ways that you can share your documents. We've got them all covered.
But Merran, I need to move on to the next part of our interview, but I guess that quickly, if you could explain what is My Health Record for those who are still not familiar with it, and why that is a really important thing to do to upload onto it.
Yeah, now My Health Record has had its detractors, but they've done a lot of work now, and there is a great movement forwards of sharing information, and we all have to use and refer to very strict privacy guidelines. When you upload something to a My Health Record, any doctor or care provider is allowed to download that and see your advanced care plan. It will store all sorts of things. It is up to you to make sure it's uploaded, and it is also up to you to make sure the fresh one is uploaded. You don't want a 3 years old PDF sitting on your My Health Record, but that's why this system helps remind you to redo it, and every time you redo your plan online, upload the new one to My Health Record.
I think this review function is terribly important.
Critical.
Let's move, for time reasons, to someone's watching this. They've learned a bit about the system. They've learned about what an advanced care plan is. They've learned some of the circumstances in which it may be important. They're still hesitating to begin, because I know you really want to inspire people to begin after this webinar. So what's the single most important reason why people should begin? Just start. And I guess use your questioning system is one way to start. Why is it important to start? Because you learn while you go.
You do learn while you go. And from my heart, Julie, the reason to start is because you will start living differently. When you see yourself as a mortal being with a life that is mortal, you start thinking about what is most important, and you live differently from the day you start thinking about that.
I know we're going to talk as we close about what to do next, and that includes your Touchstone Life Care system. But someone is saying, what does it cost? Can you just give us the base rate to begin?
Sure. So it's $149 to do your plan, and then only $10 a year every year afterwards. That allows you to change your mind as many times as you like, to share it as many times as you like, because we know people need to do their plan early. We're trying to encourage people to do it early, not wait till you're 80 or 90. And that's why it's so affordable to do it early and then keep it online for as long as you like.
So to a picture that I think embodies caring for you. And you'll remember, ladies and gentlemen, and everyone, I've asked Merran to share a little bit about the emotional side that's made her so motivated to ensure that we do an advanced care plan and have these conversations about care. If we could go to that image, what is this image and what does it mean to you?
This is a confronting image, Julie. This is an image from the film that we made. And what I want people to see here is Siraj, the nurse who is caring. She is a trained expert palliative care nurse. She has very few resources, but she's sitting there on the bed with this person clipping fingernails. And I want people to understand that in this COVID world, not only do we need to share and use technology, we're being forced to do that now, but we're also caring for each other in our own homes a lot more, not sending people to hospital. And people say to me all the time, I'm just the neighbor. I don't have any training. I don't know what to do, but I want to encourage people. We can all do this. All you need is to be a human being, to care for somebody else. You can't make mistakes if you leave your own biases at the door and meet the person where they are and do some very basic things. And when we're doing basic care for people, lo and behold, they start to trust us and they start to open up with their wishes. And this next slide, again, is from our film. This is the River Ganges in India. There is a tiny boat there. And in the film, that boat traverses the river and there is silence. And it's to emphasize that sometimes the best thing you can do for someone, whether they are talking about their plan or you're caring for them, is to sit in silence. And in this COVID world, if you are the only carer who is allowed to be with someone, or the numbers are lower, you're not going to have the loud chit chat. It might just be you and your person. And sitting in silence together is a very powerful, underrated way of loving and caring for people.
Merran, can I just say, I found it interesting, the earlier image, if we could just see it again for a moment, the lady sitting on the bed, you call that confronting, whereas what I see is intimacy, is physical contact, and most important is relaxed comfort in the presence of the later stages of life. And I've been lucky enough in my life to see very good quality, both palliative care and family-based, home-based care supported by home visiting palliative nurses. And I find that a reassuring image.
Oh, I'm so glad. This is from when I was working in this space, in this room with people in India. And what has happened here in our advanced healthcare is we have forgotten that we die. It's almost a failure. And yet, when we consider our advanced care plan, it's like a pause button and we go, I'm going to stop and think about how I want the final stages of my life to be, who I want there, what the legacy is that I want to leave, what messages and things I want to say, rather than a panic fight to the bitter end where you are not allowed to express yourself and you leave things unsaid.
Thank you. And in our planning discussions for this conversation about advanced care planning, you said, may I ask you, Julie, some questions? So I've also prepared a couple of photographs.
Great.
But what's the question you'd like to ask me?
Julie, you have, you've got a passion for advanced care planning, and I know that you've got some history in the medical world. And so I asked you to send a photograph, and you sent through this one. So I wondered if you could tell us what this photograph means for you.
Look, thank you. This is a picture of my mother, my late mother, Marjorie, who died a couple of years ago at the age of 94, and myself. This was snapped in a waiting room of outside a doctor's surgery, and I was startled by the extraordinary physical similarity between us. We even seem to have exactly the same facial expression. And I guess what I wanted to convey about why I'm so enthusiastic is I think it's really hard to put the care back into care, whether it's care during a serious illness that we may recover from, or care after a terrible accident that we may recover from, or that care where the person is definitely at the end of life, and but the coming of death is an uncertain event. We don't know when it's going to come. And I think it's actually really hard. Both my brothers are doctors, my daughter's a doctor, and many of my friends are doctors. And as a cancer patient, you know, having had a stage 4 cancer diagnosis, you are intimately involved with the health system for a 5-year period that is often quite intense. So I've had a lot to do with the healthcare system and with doctors. And I think there are a lot of good people who want to do better, but it's hard. So why am I committed to advanced care planning and conversations? I'm committed because I want to do whatever I can as a patient and family member to assist my clinical team to do the best job possible. And what I learnt with my elderly mum, if I could focus on her first, is that you just can't assume that you know what people want, that you have to have the humility and the grace to ask questions, to listen and respect. Because of time, Merran, I'll just give you one quick example. My mother became very frail. This is about seven years. If I could come back to the photo just for a moment.
Oh, sorry, sure.
That's okay, but this is about 7 years before Mum's death. And you can see she's still relatively robust, even though she's already in her 90s, but she became quite frail. And I was concerned about if she had a heart attack, that resuscitation, hard pressure resuscitation could be applied. And I'd been informed, as she had, by her gerontologist and her GP and lots of her cardiologists, lots of good trusted people, that at her age and at her frailty, the crushing effect of resuscitation could give her a devastating last period of her life. But my mother, no time to explain why, had a passionate and ferocious desire for life. And I'd say it took a good year before Mum agreed to have a little note, signed off thing from her GP that said not for resuscitation, that was copied and beside her bed. She had home-based care and in the kitchen, so that if an ambulance came when no one from the family was there, everyone would know. So in that year, Mum could have had a resuscitation that might have been devastating. So what's the message? That I had to learn humility as a daughter, to let her do, obviously let her, even that language, why does it come in? My mother had cognitive capacity and she chose to risk resuscitation until she too understood she was too frail. My next image, if I could show, I'm just watching our time together. This is a picture of me in my radiation bunker. I had 33 sessions of radiation daily and weekly chemo to recover from throat cancer. And I learned then, when I was told I had stage 4 throat cancer, I immediately said to my surgeon, if you have to take my voice, take it. I don't even know where that came from, Merran. I hadn't turned my mind to loss of voice. And that was a very important experience for me, because I didn't know that about myself, that I too, perhaps from my mum, had a ferocious will to live. I had no voice for 6 months and very limited voice for 18 months as the result of radiation. So I actually have done the questions in the guidelines in the website that Merran has created. And I've used the notes section to explain why I could cope with breathlessness, why I could cope with the inability to speak. And I've put some requests to my family and caregivers as to how they may help me to manage those experiences. So I guess I show you these pictures to say it isn't easy to know what you yourself will feel until you're faced with the situation, which is why I see the conversations that we have and the naming of key people who will make the decisions if we need to have them made, people we trust to use their judgment and to read our advanced care plan and use their judgment. Would you like to respond to what I've said?
I would, because that is the reason why we put the medical scenarios into our questionnaire. They don't appear in any advanced care directive forms. They actually pop up. And you said to me, Julie, these are the exact things that happened to me. And that's not by chance. That's because this is a very research-driven app. All of the scenarios that happen at end of life are in our questionnaire for people to ponder, not come up with an answer straight away, but ponder and then discuss with family.
Thank you. And we have time for one or two more questions. And I'll just look into our guidance from our friend in cyberspace as to further questions that we may have from our audience. One question is, could you tell us a little bit more about the film that you mentioned and where can we find it? If you could just answer that one first, please.
That's on the website, and we will also provide you a link at the end of this webinar.
And another concern is if I'm unconscious when I'm taken to a medical centre, how can I communicate what I have available in cyberspace?
Look, some of the ways that we've already discussed, it will be on your My Health record, it will be on your friends and family's contacts. So we usually go through your wallet when we're trying to identify somebody, and we find contacts, or we go through your phone and we find contacts. That the first thing is for us to identify you. Once we have identified you, it's possible to track down your medical records then. And It's called a web app because it has to be, it's written that way in the beginning, but it is available on your phone as well. It's doable on your phone as well as an iPad, as well as a big desktop. And I noticed that there's a question about witnessing. What I want to say is this: when a common law advance care directive doesn't need witnessing, but a common law advance care directive, you need a good solid one that won't get questioned. You don't want it to be challenged and conflict. And we've designed this with professors of data, information and privacy, and the sharing of this and the time-stamped signatures, the time-stamped digital signatures, the sharing of this grants it legal validity under the law. The reason advance care directives are witnessed is this: if there is a challenge, we need to know that you had capacity when you made the decisions and that you weren't coerced. So if you share it with people ahead of time, they can say, you know, I took mum shopping that day. She was completely had capacity. Or 6 or 7 family members all know about it. So the chances of a fake advance care directive or coercion are far less than a piece of paper that somebody else writes on your behalf.
Can I ask you a personal question, and then we'll move to our closing segment of what you recommend people do next? My understanding is that when it comes, well, I'll tell you what I did when I was told there was a good possibility that I'd die. So what I did was I had what was called an enduring guardianship document in my state. They're a bit different everywhere where you live, but it nominated in a legal way who could make decisions on my behalf if I couldn't make decisions. And I had an enduring power of attorney that nominated who could manage my affairs if I couldn't manage my affairs. But I also had an advanced care plan, just as when I complete my Touchstone Life Care plan, I'll have an updated one. And I saw them as complementary documents, not exclusion me.
In fact, if you have an enduring power of attorney or enduring guardian, if there is an advanced care directive, they must follow it. GPs, doctors, their code of conduct is if there is an advanced care directive or similar, they must consider it. So that's why in the app that we've made, and you'll see it when you use it, it is possible to say this person is also my substitute decision maker and also my enduring power of attorney. Absolutely crucial that you share your advanced care directive with your power of attorney or health enduring guardian, as well as others that you need to know about it.
Thank you so much. I'd like to, if I may, ask you, Merran, to give us the final information of how we keep the conversation going, what we do next. Over to you.
Sure. So to keep the conversation going, and as Julie said, just start. Just start with one question. You can book a conversation with some people within Touchstone Life Care or myself, and there's a 50% discount offer for that booking. Do that through our website, www.touchstonelifecare.com. That's 4 words altogether, touchstonelifecare.com. You can go on to touchstonelifecare.com and start your plan. Just start. It doesn't have to all be done in one go. Or again, go to the website and watch our film called Start the Conversation, where you will see some people who have dealt with these exact conversations themselves and give you a fascinating and unique perspective on conversing about dying.
Including, I think, a palliative care doctor who I found just so helpful. And I noticed that in the chat, we're getting links to everything that Merran has been discussing. Well, look, ladies and gentlemen, I think I'm ready to book my guided conversation. I'm aware there's a special offer. I really recommend completing the questionnaire. It's got me thinking and talking to my family. And I'm keen to finish this process and upload it. Is there anything else you'd like to say, Merran, before I close this webinar in
I think
Plan Week?
Julie, you've nailed it. It is just start. Just start the conversation, and we have lots of tools and tricks on the website, even phrases that you can use like, Mum, I'm concerned that if something was to happen to you and you had to get taken to hospital, I wouldn't know what to tell the doctors. So can we please talk about that? just some little actual introduction questions so that you can start these conversations. Absolutely essential.
That is just so helpful. And I noticed just finally that there is a link there, particularly for aged care providers and specialists to learn more. So you obviously offer demonstrations particularly targeted to those working in aged care.
Yeah, those working in aged care have to do this now under quality standards and new legislation coming in as a result of the Royal Commission into aged care. So home care providers, residential care providers, even aged care specialists in financial and estate planning have to provide this holistic care. And the best way they can help others do their plan is to first of all do it yourself. You can't be advising other people if you don't have a plan yourself.
Look, Dr. Merran Cooper from Touchstone Life Care, I want to thank you so much for the work that you do and also for our conversation now. And I just want to thank everybody who's watching this today, who's joined us live or who's watching this via the cyberspace of later time. It's just fantastic that you've been prepared to take an interest in this for yourself and others. This is deaf sign clapping, and I'd like to close, if I may, Merran, by wishing everybody well, and thank you for joining us, and we look forward. Thank you, Merran, to you joining us next time. Bye-bye.